Thank you, Kathy. And we're all using your slides, by the way. The final speaker today for our panel is Nicolaas Pronk, who is the Vice President and Chief Science Officer of HealthPartners, and George Ishams, former colleague at HealthPartners. Nico, you're up. No.
Okay. So, I guess what I can do is just start talking through. So the idea was to really talk about two particular topics today. One would be to outline a couple of reasons for business investment and involvement in population health efforts, and then secondly, to really present the results of an executive convening that we hosted in really trying to get to the underlying rationale that a business case in the creation of a business case for companies to invest in community and population health. So the first listing, if you will, of a rationale drawing from public and population health sciences perspective, the Community Preventive Services Task Force has over the past 15 to 18 years now identified several reasons why community health improvement has benefits to multiple stakeholders, including business and industry. So these include things like that you clearly have heard before: reduction in healthcare spending through lowering the need and the demand for healthcare, reducing an illness burden by focusing on fewer cases of illness and improved function, making healthy choices the easy choices, environmental and policy changes, maintaining or improving economic vitality, where healthy communities in fact complement vibrant business and industry, increasing healthy longevity so that today's youth in fact will live longer and more healthy lives than their parents instead of what we are witnessing today, enhancing national security by recognizing that obesity in fact today has become the leading reason for failure to recruit into the military, and then finally preparation of a future workforce, which is all about a healthy workforce through education and skill building. Color. Thank you. So Eccles and colleagues tell us that sustainable firms generate higher profits, stock returns, suggesting that developing a corporate culture of sustainability may in fact be a source of competitive advantage for a company in the long run. That means a more engaged workforce, a more secure license to operate, a more loyal and satisfied customer base, better relationships with stakeholders, greater transparency, more collaborative community, and a better ability to innovate. All of these are contributing factors to potentially persistent, superior performance of a company in the long term. But furthermore, workforce health and a connection to the community that position a company in a positive light are related to long-term sustainability. So to learn more about this particular issue, Dr. Kathy Basi and I actually co-chair a health enhancement research organization, or HERO initiative, to look at the reasons why employers may want to play an active role in community health initiatives. So HERO hosted an executive convening to learn more about this business case, and that convening was informed by an environmental scan that was actually commissioned by the Population Health Roundtable at the IOM. And that environmental scan told us that there is already a lot going on in the community in terms of business involvement. In fact, several stated reasons identified in the scan included things like enhanced reputation in the community as a good corporate citizen, cost savings that would increase over time, job satisfaction for employees, healthier, happier, and more productive employees, and a healthy, vibrant community that draws new talent and retains current staff. We hosted the convening using a World Café process, which is a very simple method of bringing people together in a way that optimizes through conversation the collective intelligence of the group, if you will. It basically is a very simple process organized around small groups in table formats. People get to talk about a particular question that matters, and we try to glean the insights of that conversation. We posed two critical questions. One was focused on what are the strongest elements of a business case that will generate higher levels of employer involvement and leadership in community health, and what are the most important barriers and limitations that would keep employers from playing that critical role. The results included 7 themes that came out in terms of the business case. The first one being metrics and measurement. A clear need for a common definition and a set of metrics for the measurement of health relevant for both business and the community. Return on investment. It is important to talk about this business case in terms of language that the CFO can understand. And investing in the community actually may lead to greater profits. Clear communications. When articulating the business case, the messages need to be clear, focused, and relevant. There is a need for different value propositions for different sized businesses, and there may need to be a pooling of resources with other businesses in terms of getting the investment right. Shared values, important to understand shared risk and shared values between business, and communities and stakeholders, so pooled resources, shared benefits, and shared expenses. Recognition is important to be seen as an employer of choice, and community of choice as well. Shared vision in terms of employers and communities needing to focus on sustainability with the integration of a culture of health internally to the company as well as externally to the community. Shared definitions, recognizing health beyond medical care. Things like, what do we mean by a leader? What is meant by an influence model for business in their community? And then finally, leadership and buy-in, recognizing business leaders are needed that can communicate the value of community to their peers. The second question was related to identifying the barriers. There's a list of barriers identified here. Lack of understanding, lack of a strategy or a playbook, overall complexity of the problem, issues of trust, lack of a common language, ROI, lack of metrics. So things like lack of understanding representing what does health actually mean, a diverse agenda and the potential misalignment of multiple stakeholders, who is responsible, and in terms of the benefit, how high is the risk of putting your toe in the water, so to speak. The lack of strategy or a playbook, it's if you figure out the why to invest, then the how and the what become very important. But there is a lack of frameworks or models to use. There's a lack of a playbook to tell us what to do. The complexity of the problem shows up as a barrier in that the vision is so large that it goes beyond what an individual employer can conceptualize. It needs to be doable and chewable, in their words. The need to walk before you run. Can you, rather than diving in right away, is there a way to sort of build this incrementally? The problem is enormous and needs to be simplified so it's easily understood. Trust. Companies are not necessarily willing to take the risk of being a first mover. So a lack of trusted convener becomes a major hurdle or barrier. Lack of an infrastructure to actually work the solution in. And although coalitions have been formed, people just don't know each other and don't know who to trust necessarily. Lack of a common language also shows up, and interestingly, this is one of those examples where language also includes measurement, and perhaps measurement can be used as a language in and of itself to bring people together. So as we put the World Café results into a set of overall impressions, it became clear that there is a great variability in understanding the rationale for business involvement in community and population health efforts across employers. The cost of healthcare has become a threat to much needed investments in other social priorities. A shared commitment for action, however, could be generated through processes like this World Café kind of forum, bringing people and organizations together. But the need remains for a powerful yet concise articulation of the business case for these efforts, and then following the acceptance of the why as a business case, a roadmap for action is needed to guide the how and the what. So in an effort to summarize these results and put them in the context of a business case and how companies may actually evolve through a continuum or across a continuum wherever they may find themselves, early on the main driver for engagement in population health may well be entirely driven by regulatory requirements, such as an OSHA requirement, for example, to worker safety. The next level refers much more perhaps to a charitable giving, providing opportunity for companies to be visible in doing good. Moving from there to be more strategic, companies may set up systems to connect health and safety to business value, and then that eventually may become a systemic approach akin to creating a culture of health, well-being, and safety at the workplace that connects to the community and reflects a norm and value system that appreciates the need to address macrosocial determinants of population health. Benefits that may drive an intentional investment that represents doing well by doing good, in fact, would drive value and link to business performance issues such as enhanced corporate image, the visibility, the stewardship, and the social responsibility of an organization, being an employer of choice, enhanced employee morale, job satisfaction, job fulfillment, teamwork, engaged employees and increased productivity, increased creativity and innovation, improved attraction and retention of top talent, reduced sickness absence, reduced absenteeism in general, presenteeism, turnover, improved productivity, reduced workplace injury, reduced benefits cost, which would include healthcare costs as well as short-term, long-term disability and workers' comp, better management of an aging workforce, increasing awareness and knowledge of self-management of health, but also things like reduction of workplace stress, injuries, increased energy, resiliency, and vitality, and increased employee engagement. So, to sum this up, in the words of Marjorie Carter, be community boldly. Thank you.